moment, let's turn to the story that concerns all of us. Kerala has intensified its battle against coronavirus as the number of confirmed cases in the state today climbed to 14. Kerala has been put on high alert. The state government has advised all educational institutions across the state to remain shut till the 31st of March. Major tourism destinations and cinema halls will also remain closed till the end of the month. Here's a report.
Kerala has begun its second battle against coronavirus. The state is shifting into self-isolation. The aim is simple: minimize contact transmission of COVID-19. The government has advised all education institutions and madrasas to shut down. Major tourism destinations are also closed. Cinema halls are shut. These measures are in force till March 31st. Temple boards and churches are scaling down festivities to minimize crowds. Public has been advised to scale down weddings. The slew of measures have been taken as more than a dozen people have been infected by the virus. The COVID-19 cell is now working round the clock with data on infections being fed in by the health department.
This map actually gives us location-wise data of the contacts of cases. Cases are those who have the disease. Contacts are those who have been in contact with the cases. You can see high-risk contacts over here, and surrounding the particular area you can see low-risk contacts, which like low risk is represented by lighter shade, high risk is represented by darker shade.
Pathanamthitta is the hotbed of the new outbreak. A 3-member family that returned from Italy allegedly skipped the screening at the Kochi airport and reached Pathanamthitta. The disease got transmitted to 8 others. The health department has released a route map of the family to track down people they visited.
Public gatherings ഒഴിവാക്കുക എന്നുള്ളതാണ്. സിക്കായിട്ടുള്ള ആളുകൾ തീർച്ചയായിട്ടും നിർബന്ധമായിട്ടും അത് ചെറിയ തരത്തിലുള്ള ഈ ആളുകളൊന്നുമായി കോണ്ടാക്ട് ഉള്ളതോ വിദേശ യാത്ര ചെയ്യുകയോ ചെയ്യാത്ത ആളുകൾ പോലും സിക്കായിട്ടുള്ള ആളുകൾ ഇത്തരത്തിലുള്ള പബ്ലിക് gatherings ഒഴിവാക്കുക എന്നുള്ളത്.
As Kerala continues to be on high alert over COVID-19 fears, the centre and the state are leaving no stones unturned. With universal screening imposed in all international airports, passengers coming from any foreign nation will now have to undergo this mandatory health checkup before they can proceed to their respective places. With this, the state authorities hope that they can contain any further outbreak of this deadly disease. With camera person Tinku Rajshekharan, Gopi Krishnan in Thiruvananthapuram for India Today.
And joining me now is Dr. Amar Fethal. He is the Nodal Officer Public Health Emergency in Kerala. I appreciate your joining us. Mr. Fethal, it appears that the Kerala government now believes that this is a situation that must be seen as an emergency. All education institutes, cinema halls being closed till the 31st of March. Why is it that you've had to take now this step, which earlier when 3 cases were detected, you chose not to take? Do you fear that the problem could now spread across Kerala, that the virus could be spreading?
The big difference between the initial 3 cases and these cases which we have now, the 14 cases which we have now, is that those 3 cases were picked up under surveillance. They were kept under home isolation. They were given all the advice to report when symptomatic, which they all did, and then they were shifted by secure ambulance to the secured medical facility for treatment and testing and all that. But here we have a situation where people carrying the virus came into the community bypassing certain checkpoints at the airport, and unwittingly, unknowingly transmitted the infection to others, including close family and some associates of the family. So this is maybe what we can call a cluster of infection outside the country where they got it. So they have now given it to people inside the location, inside the district of Pathanamthitta. And in the meantime, in the period that they were there, yes, and before they could be detected, they had travelled quite extensively. That means unknowingly and unwittingly putting innocent people at risk. So now we have released what we call a time, place and time, place map and date map, which shows the entire route where they travel. This is a very innovative idea which has helped the public to cross-check instead of having a mass panic that I was there when they came, I don't know what to do. Instead of that, the route map which very clearly shows them what time to what time they were at each location. So with that information, the public can become aware of their risk in a much more focused manner, and others need not be afraid, or need not be concerned about it, or need not be alarmed about it, but only those who are really at risk have been asked to report to the authorities. Now the public is responding to this innovative idea and reporting to us.
But Dr. Kettle,
on the basis of that, we are keeping
the
them all
fear
under
is
quarantine.
Let's be clear. The fear, of course, is, as you said, that so far most of the cases are so far the cases are of those who have come into contact with people who come from abroad. Kerala has a large NRI population, people coming in and out all the time. Are you worried that this could now spread into communities? That's what we've seen in the West, that it starts with clusters and then goes into communities. Is that the fear that is there, and what is being done to ensure that that fear is controlled?
Yeah. That is our entire aim. We have introduced a big set of war-footing measures to ensure that a cluster remains a cluster without going to the community. So that is why our measures are so extensive and so high impact measures like closing down schools. It's quite proactive. We are doing things that actually ahead of the time that they should be started. So such a proactive step that the government of Kerala and the Department of Health is taking, closing down schools, advising everyone to avoid ensure social distancing. We are even advising people to avoid travel from other locations outside India to Kerala if they can avoid it. And then we are also ensuring 100% screening of the people at the airports now, and ensuring that everyone carries home a leaflet containing essential advice and contact number of our helpline, which is called Disha. We have this Disha helpline which can provide access to anybody at any time to the concerned experts and specialists and public health specialists who can give them correct guidance. So we have also advised people to avoid mass functions, festivals of any kind, any religion, any place, and also mass gatherings of any sort, meetings and all that, so that the chance of unknown transmission can be reduced. So we aim to keep this cluster and confine it to a cluster and hope that the patients will recover without even one person getting it outside the cluster. So that is our aim, entire aim.
Well, that's I can see that the Kerala government,
dedicated professionals on the job.
Right. I'm delighted to hear that Kerala is being so proactive. This is a big challenge, and what Kerala thinks today, hopefully India will think tomorrow. Clearly, you are taking no chances, and that's why you've decided to take this major step. I appreciate your joining us, Dr. Kettle, and telling us why Kerala has taken this big step to control coronavirus.